Still rolling.
And we will talk about it, but I am here to say that there is a God, without a doubt. A few days later, I collapsed.
Wow.
They took me to the emergency room. They did a chest X that showed the presence of a large mass in my chest. They took me to emergent surgery because this mass was actually compressing the major vessels that bring blood to your brain and other vital organs. They came into my hospital room. I was 26 years old, and they said, you have stage 4 cancer. You have 3 months to live without treatment and 20 months to live with treatment. You need to drop out of medical school, and you won't be able to have children because we need to start treatment immediately. Wow. And then the hardest thing in my journey actually happened after the time when my husband died unexpectedly. I found him. He died in his sleep. And that for me is how I can relate to people, because that was totally out of my control. And what was I going to do? Here I'm a young woman with a major health issue, a young daughter. I needed health insurance. I wasn't working at the time. And now my husband dies. What was I going to do? I remember kind of looking down, and that was my last conscious memory. And I had a 4-minute near-death experience. I've had 3 amazing experiences in my life. 1, childbirth. That's the most beautiful thing. Like, talk about awe-inspiring experience. Number 3 was the near-death experience, but number 2 was waking up after my heart transplant. And I remember hearing this harmonious sound. It was like angel. I didn't know what it was, and I was just thinking, whoa, like, what is this? Like, I wasn't really sure if I was awake. I really didn't know what to think, but the sound was so amazing. And then it dawned on me, wait a minute. It was my hair brushing against the crisp white linen sheets to this powerful beat of my new heart. Like, my whole body was like going up, and I hadn't felt my heart beat for 18 years. I didn't know you could feel your heartbeat. I forgot what that felt like.
Wow.
But I was alive. Like, I was alive. I made it. Mm-hmm. And I had total clarity of thought. And what I would describe is it was like every single cell in my body was oscillating this higher vibrational frequency. And I haven't lost that. And I'm alive. I'm so alive. And I'm confident that everyone can get there.
Yes.
We just have to get out of the way and just trust to make it.
Oh my God. Okay, quick story. I met Dawn yesterday, literally. I was filming another podcast, and when I met you, you literally were the sweetest, kindest energy I've encountered in a long time. We don't know each other formally prior to filming the show yesterday, but when I met you, you had this energy and this presence where I was like, she is such a sweetheart in the way that she carries herself. I wonder what her story is. And then I listened to your story while you were on this podcast, and I was just blown away by your resilience, your ability to shine, even though you've been through so many things. And also, I feel like your energy empowers others to want to be themselves, and just whatever's going on, let's reconsider life in a different perspective. Because literally we had a conversation after the podcast, and I was like, I wasn't going to say anything to you. I was just going to be like, okay, have a good day. No. And then I was like, no, I have to tell her, she is so sweet. And the fact that you've been through so many, and the audience is going to hear your story today, but you've been through so many things and you run a very busy practice at the Mayo Clinic, and you are just flying everywhere, going on different podcasts, doing everything that you possibly can. It feels like you want to just help people. So Dawn, thank you so much for being on the show. We do this thing in the beginning of the podcast. It's called what's your origin story? So who are you? And how did you get here? To this point in your life?
Thank you. Oh, gosh, Oscar. Aww. Thank you so much for what you just said. Mm-hmm. And I am such a believer. Life is like a mirror. So what you see in me is you. And that is exactly how I felt about you. And the hug that you gave me as I left yesterday, it just warmed my heart. I mean, life is about love and connection and pausing to have these human experiences. So it's very meaningful to me that you're taking this time. Thank you. Thank you. So I am unapologetically alive, and I was born this way. I say I literally jumped out of my mom's womb with this big smile on my face, and I was like, life is on. Here we go. Let's go. And it's the cutest thing in the world, because if someone said, what do you want to be when you grow up, Dawn? When I was 4 years old, I would look them right in the eyes and say, I want to be the oldest person in the world. And this is in the 1970s. This is a long time ago. I was just obsessed with wellness at a young age. I mean, so my favorite childhood memory was going to the health food store with my dad.
The health food store.
The health food store. Not Disney World. No, the health food store. If I could go to the health food store, I was happy. I was really into healthy foods at a young age, would always take those on field trips. My favorite book to read was Life Extensions. This is way before your time. But at a young age, in like the 5th grade, 7th grade, into high school, I would read Life Extensions. Not the most evidence-backed book, but it's kind of how the Life Extension supplement company came to be. It's really cool. So I was really into this. Took that passion that I had for wellness into my undergraduate training at Ohio State, and I studied exercise physiology and nutrition. And I took really good care of myself. I would always wake up every morning, even as a youngster, at 4 a.m. I just love to rise and shine early, have lots of energy. Let's start this beautiful day off early. And so I was a big runner. I did fitness competitions. I really subscribe to the healthiest of lifestyles. There is no perfect lifestyle. I want people to know that. We should never compare our journey to someone else's. I feel that the adversities that I did encounter later in life, the loving upbringing that I came from, is what afforded me the resilience that I've been able to have. And it's that smile on my face. It's that authentic joy, because my entire life was rooted in love. And so I can't imagine something different. So for me, my journey's been easy, even though people hearing may say, oh my gosh, how? But that's why.
Wow.
Still rolling.
So sorry.
Yeah, you're good. I hope it's someone special. We should say hi. We should invite them.
You're on the podcast.
Ask a question, any question. All questions open.
And that's going to stay in there. I think the main reason why I'm so, you just said something that's really interesting, where you're like, for you it's easy because your life has been based in love. Like you grew up with that energy, or that around you. Was it your parents? Was it your family? Like who did you see that you emulated when you were a kid?
I think it's an important question. And I think it started at the point of conception.
Really? Straight out, like you said, straight out the womb?
No, my mom shares this remarkable story that she knew the minute she was pregnant. And she said she remembers being just filled with joy. Wow. She was so happy.
Yeah.
She knew she was pregnant. And she said she was pregnant, happy her entire pregnancy.
Yeah.
And, I think that emotion carries over. Our emotions are so powerful, and on the epigenetic level, that generational communication to the baby and connection when you're connected to your mother. I think that's why. I don't know. I don't know that I've ever met someone that has quite the level of authentic joy as I do. And it's not toxic positivity, because I do acknowledge hardship and despair. And I've had hard times, and I acknowledge it. Yes, those were hard times. So it's not that I'm always up. It's just that I can bounce right back to that up very easily. Once I acknowledge, okay, this is rough, let's get back up there. So I attribute who I am today to my mother and my father, probably our grandparents. I think generationally, that is who we are a part of. And it's for a reason. We're each on this earth for a reason, whether that's because we're the happiest person in the world or because we're maybe very sad. There's a reason for all of this, and we just have to look for the lesson in our purpose for being here. That's what I believe.
Wow. The lesson in your purpose for being here. So it sounds like you've had a history of people in your family who just have been these very positive, joyful, spiritual, connected people, which is awesome. I think some of the people who are going to be watching this show are people who have dealt with hardships and are trying to figure out their resilience and how to navigate something that's difficult in their lives. So you went through a couple of different things in your life, and I'm sure there's so much more to your story, where you were faced with different types of difficult, life-threatening health concerns. And so when that happened, can you take us, what we call in filmmaking, it's called back to one. So back to the beginning of that journey. Were you in school, were you a doctor already? Did you have your partner with you? What was going on in that time?
So lived this healthy lifestyle, studied the exercise physiology and nutrition, went on to do research at the Cooper Institute, which is this very prestigious cardiovascular research institute in Dallas, Texas. And after my research studies there, I decided to go to naturopathic school.
Okay.
So I went to naturopathic school before traditional medical school. I learned a lot there. That's an important part of my story, I feel, because I really learned some ancient wisdom from healing, holistic modalities of healing. But then from there, I knew I wanted to go to traditional medical school. So in 2000, I went on to traditional medical school. And it was a few months into medical school, I wasn't feeling good. And up to this point, I would run 10 to 14 miles a day. I went to medical school in Arizona. I would climb Camelback Mountain twice a day, up, down, and it was effortless.
Wow.
Few months into medical school, that no longer was effortless. It was like, whoa, what's happening? For anyone who's done Camelback, there's these stairs that you have to do in the very beginning of Camelback. It got to the point that I get to the top of those stairs, I was like, ooh, I'm kind of having a difficult time breathing. So I saw a doctor. He said, oh, it's asthma. He never listened to my lungs. Just gave me an inhaler. Went about my way, used it for a few weeks, wasn't getting better. Saw another doctor. He said, use it more. So now I start using this inhaler more. My heart's racing. And now I can't even get up 2 or 3 steps. I could barely walk from the parking lot to the stairs at Camelback Mountain. And I'm thinking, what is going on? So I see a third doctor, and he says, it's in your head. This is something that happens to all medical students.
Wow.
And so at this point, I'm totally beating myself up. I'm like, toughen up. Like, what is wrong with you? And he even went on to say, are you studying pulmonary health, your lungs? And we were, of course, And so I really thought it was in my head. And I struggled with that, just thinking, why are you manifesting these symptoms? Why are you so weak? I was really coming down hard on myself. A few days later, I collapsed.
Wow.
They took me to the emergency room. They did a chest X that showed the presence of a large mass in my chest. They took me to emergent surgery because this mass was actually compressing the major vessels that bring blood to your brain and other vital organs. And so it's called a thoracotomy. They open up the side of your lung, and it's actually the most painful surgery someone could have because of all the nerve endings.
Wow.
This was Thanksgiving of 2000, the week of Thanksgiving. And so they do the surgery, they pull the tumor off the vessel so they can establish the blood flow properly. They sampled the tumor. The next day, they came into my hospital room. I was 26 years old, and they said, you have stage 4 cancer. You have 3 months to live without treatment and 20 months to live with treatment. You need to drop out of medical school, and you won't be able to have children because we need to start treatment immediately.
Wow.
And so here I was, this very healthy woman and very happy woman, right? And I was just thinking, oh, and that was literally my response was, oh, okay, so these are not the doctors that can take care of me. I was just very methodical, very serious. And all of a sudden there was like an equation, quick assessment of how we're going to get back on track because I need to get back to my joy, right? I need to get back to how do I get to be the oldest person in the world, bounce over this cancer thing. But, it was just me. I have my parents, but I could be pretty relentless in this cancer journey and just really show up for myself. I was going to listen to my doctor, so I did do the chemotherapy, but I didn't listen to the other nonsense. They really wanted me to drop out of medical school. They thought that would be the safest thing for me to be able to go to my appointments and do the chemotherapy, but I didn't do that either. And I ended up hiring doctors that I trusted, doctors that could do the job that I needed them to do, doctors that would allow a naturopath to work right alongside of them. So I did conventional care as well as the holistic care. That's really a definition of integrative oncology, is combining the best of both worlds. And I did just that. So I did chemotherapy for many months. I had to do a bone marrow transplant.
Wow.
And then that was followed by many weeks of radiation therapy. And I just remember it. I had so many beautiful people in my life during my chemo. I was single at the time, but prior to my cancer diagnosis, a lot of people say, well, how did this happen? Because I did. I took care of myself. I ate the healthiest of diets since day one. I exercised. I had love. I had faith. So how on earth does cancer happen, right? I just started sharing this. I shared this for the first time with Mona Shaw this morning.
Okay.
And the love of my life came home one day and said, I met the most beautiful woman in the world. And he had fallen in love with the other woman. And I think that's it. I think that was my trigger because it didn't fit, right? Like nothing. And the tumor was wrapped around my heart, and so it was just total heartbreak. And I think that could have very well been the emotional trigger. And maybe there were some other insults. As a kid, I would play in the creek. That was a runoff of pesticides. So, cancer is like a baseball game, not literally, but in terms of the insults, it's kind of like 3 strikes and, it may be there. Your immune system is always ready to go and kind of ready to keep cancer in check. But if your body has had so many insults, it kind of just can't keep going, And I think that's what happened in medical school. I wasn't really sleeping as well as I should have been sleeping because I was studying all the time. And of course, there's some stressors with medical school, but they were filled with meaning and purpose. So I don't think that was it. And back then, I didn't ask the question. I didn't really care why. I knew I just needed to do what I needed to do in terms of my health. And so I stayed in school. I went on, and I remember during my bone marrow transplant, I'd wake up every morning at 4 a.m. They had a bicycle in my hospital room as well as out by the nurse's station. So wake up at 4 a.m., climb, out of the room, on that bike in the nurse's station. And I remember looking out and seeing all the other patients so sick. And it was like they were dying in an effort to stay alive. But I just remember attaining my vitality without pause. It was like I was this same joyful, happy, well-feeling being at a moment when I was really dying. And now when I see pictures, I was really sick.
Yeah.
But I didn't see that. When I looked in the mirror, I still looked like Dawn. I thought good, but I actually looked awful. It's kind of crazy,
Yeah.
And so the cancer was cured. The stage 4 cancer was cured. These really heroic treatments they did actually cured the cancer. This is a shout out. I have so many women that come in to see me and they don't want to do the chemotherapy. They want to do it naturally. Well, guess what? I was already doing everything perfect, naturally.
Right.
I needed the chemo. There was no place else to go. Cancer is cancer. It's not a good thing. So I really believed in the cancer treatment with the chemo and the radiation. When I would go to my chemotherapy, I remember doing a guided imagery, visualizing the cancer treatment, going to those cancer cells, eradicating those cancer cells, being one with that treatment, accepting the treatment graciously, gratefully. Thank God for this treatment to save my life. When I have patients coming in turbulent, like, I will not do chemo, they're angry. They're angry at the cancer. That is a mindset that I really want to work on. It, quite frankly, doesn't matter what you eat, doesn't matter how much you exercise. Nothing else matters until you accept that diagnosis. It's there for a reason. Look for the lesson. That gives me chills to say that. But if we fight it, you're going to just remain in that misery for a long time.
Wow.
It's like that art of acceptance,
The art of acceptance, okay. That I feel is probably one of the hardest lessons to learn in life for anybody. And just sitting with something and looking at it, especially something that could be fatal.
Why though? That's my question to people.
That was going to be my.
Why?
That's literally it. Is like, why is it so difficult though? Yeah. And actually, I was speaking to my therapist, and I was telling her like, what is it about like our ability to just be negative? Like, why are people so prone to like not be like more empowering or resilient or when something goes in a different direction, like why is it so easy for us to do this? Like, oh, well, nothing goes right for me, or like, have that type of attitude. And she said, it's innate. It's like our brains are primarily we're built to survive. So back in the day when saber-toothed tigers and all these things were like, threatening people, it's like your brain is thinking, I need to survive. And so when you learn a certain pattern of like, oh, this is something that I don't like or something that I'm afraid of, the skill is learning how to regulate that when like, for example, when you said you're quick to bounce back, like, oh, this is bad, but I'm also like this person, and you remind yourself why you're able to move forward. I think that's difficult for probably, I want to say 80% of people. That's just a statistic I'm throwing out there. But I know for me, it's been like a lot of people tell me that I have like insight that other people don't. And I personally don't see that. Like, I don't understand that. It's like me telling you, like, you're such a kind, loving, joyful person. You're like, I've been like this my whole life. Like, I don't know anything different because you're rooted from love. And so I'm always curious, like, well, why do you believe it's so easy for some people to bounce back and, have a recovery from something like stage 4, cancer, which is, and also the other part of it is you had a different experience afterwards when you were giving a talk on stage afterwards. If you want to talk about that, you can. But I guess my question is like, why do you think it's so much easier to train the mind in the negative way rather than in the resilient way?
Yeah, I mean, what you're talking about is exactly right. It's that negativity bias. Our mind is wired to look for the threat because that was the only way we could survive. But really, we don't have the saber-toothed tigers anymore. And for me, I really feel the answer to what you're asking is belief in something bigger than self. You know, and I also think, and this is not with you, but for some maybe, and there may be also this like, the ego gets in the way too, you know, of some of this. And so for me, I took my own mind, my own thought, my own ego, and asked it to go to the backseat. And I just handed everything else over to God. Whatever that is you believe in, universe, spirit, whatever it is. For me, it's God. Hand it over to God. I trust. I just trust that. Why? Like, why go against that force? I mean, I am, and we will talk about it, but I am here to say that there is a God, without a doubt. And if there wasn't, I mean, at conception, you know, there's this burst of light.
Yes.
I mean, so like when you see the light in other people, like when there's conception under electron microscopy, if they look at it under the microscope, it's just burst of light. It's the coolest thing. I'll have to share a picture with you. But it's really super cool.
Yeah.
So, you know, we're all from light. You just have to reestablish it and just trust. So for me, it's just that belief. But it is interesting. So after my cancer treatment, you know, I had all these very special people in my life, and I had met a very special man at that time. And we ended up having a miracle. We were able to get pregnant. And so I was able to deliver a beautiful, healthy baby girl in 2003, just a few years after my bone marrow transplant. Total miracle.
Even though the doctor said otherwise.
This was not happening. They actually wrote it up in a medical journal because it shouldn't have happened. I wasn't even having menstrual periods and I got pregnant. Like, it was that crazy. And my husband was a little bit older than me too. So he was like, what? I was like, what do you mean? I'm like, yeah, we're having a baby. And we were tickled. Like, it was just like the coolest thing in the world that we were going to have a baby. And I was in medical school. I was just finishing up my last year. But a few weeks after she was born, I started not to feel well again. Only this time, game off, narrative different. I'm a mom. I'm a wife. I don't want anything to happen to me. So now I'm like really scared because it felt just like cancer did. Same exact, like suffocating feeling. Felt like there was an elephant on my chest. Didn't go to the doctor. Didn't go to the doctor until I had to go to the emergency room. And it was the same thing. I was again in cardiogenic shock. Only this time they did an ultrasound of the heart that showed my heart was only beating at 8%. I was in advanced heart failure. And so they came in the room, and again, they're like, you're going to need to drop out of school, you know, residency. I'm like, okay, I think I agree with you this time. We're not going to drop out. We're going to take a little break. We need to get better. And this is when I became a patient, actually, at Mayo Clinic. I was a resident at Mayo Clinic, but I also became a patient at Mayo Clinic for the first time. And they filled my heart with hope. And they just said, you know, we're going to do treatments. When those don't work, we'll have to do procedures. And when those don't work, you may need a heart transplant. This is in 2003.
Wow.
So that's what they did. They did the treatments. I started getting stronger. These were just medicines and cardiac rehab. So I was tickled about that. And I got myself back to residency. And, you know, I went to residency for a few years and I just worked so hard, long call shifts. This was back in the, you know, 2003, 2005 time when the work hours were not restricted like they are today. So you're working, you know, 36 hours straight with no sleep. That's not the healthiest thing for someone with heart failure. I remember going to codes, you know, someone's heart stops like code blue, room such and such. And you're like running up the stairs to go save someone's life. And I remember trying to run up the stairs to go save a life. I'm like, oh God, they're going to have to save my life in a minute. So I'd have to slow down as I'm running to go save someone else's life. It was crazy. It's like, and no one knew I had this. You know, I try to be really just in my own lane with that because it wasn't about me. It was, I was there to serve other people in my role as a physician, as a young physician. So that's what happened. But you know, I overdid it. So after a few years of residency, I had to take some time off. This is 2007. And then the hardest thing in my journey actually happened after the time when my husband died unexpectedly. I found him. He died in his sleep. And that for me is how I can relate to people because that was totally out of my control. And what was I going to do? Here I'm a young woman with a major health issue, a young daughter. I needed health insurance. I wasn't working at the time. And now my husband dies. What was I going to do? You know, and it was like that joy that I described. Do you know that Disney ride or the amusement park ride where you're at the top and it free falls?
I think so.
It's like, it basically is this ride. It just,
yes. It's the elevator.
Okay, yeah.
Yes.
I've never gone on one. I did in real life emotionally, but not on the actual physical ride. But my emotions were that. This elation, joy, I'm like bouncing in there like, honey. And I find him and he was cyanotic. And I thought, I remember like hitting him like, don't do this to me.
Oh no.
You know, and my joy just fell. And for the whole year after he died, what I would describe is I couldn't handle any stimulation. Like I couldn't hear music. I couldn't hear loud voices. I just had to have everything very still. And it was just my way of kind of survival. And this was when I really became spiritual or one with my faith. It's one thing to be religious, but that doesn't mean you're necessarily spiritual. It's one thing to be, I guess, have religiosity and not really practice that belief. And during this time, it's just like my faith became really one with me. And what does that mean? And it really means just about living in a vessel of love for others, for self, for your family. And that's what I learned. And it was a miracle. I actually got stronger. Within that year after him dying, I got stronger. I was able to go back to residency and finish. I got stronger. I even did a fellowship in hospital medicine and became a hospitalist at Mayo Clinic, which is a really intense career choice. You're on a lot of call shifts, long hours, but I loved the challenge. Yeah. And from all of my health adversity, I actually had a lot of good insight. I had a lot of good, almost like intuition, if you may. I knew what was wrong with people. I knew how to make the right decisions. And I had great training as a Mayo Clinic doctor. So I was really proud to be a hospital physician. And that's what happened after my husband died. It really helped me understand the concept of heaven. There had it for me to be a heaven, to know he was safe.
Yeah.
So it was really hard. Loss is the persistence of love. And it was interesting here in California, my visit, my hotel room, I posted on my Instagram, there was a heart in the marble. It was like this little godling. I call them little glimmer moments, And I was like, I think he left that for me. And I cried. Like I was really emotional. I cried it was been many years ago and I still get emotional, but it's like beautiful emotion. It's just the love that I had. He gave me this beautiful daughter. And without that, I can't imagine. I can't imagine. Some people will never experience that love in their life, but I at least had it once. So it was just so special. And yes, there was this little heart. And I thought, I think that's a message. It was really sweet. I see these beautiful things all the time.
Yeah.
But when, did my hospital work, and in 2015, I just couldn't do it anymore. I would be driving and almost pass out. I was having word finding difficulties. My heart was getting weaker. So I had to transition to the outpatient practice at Mayo Clinic. And they had asked me, well, what do you want to do? And so what the plan was for me to design the Integrative Breast Oncology program at Mayo Clinic. And that's what I do today.
Wow.
In 2016, it was a year after that program had started, I was given the opportunity to present to Mayo Clinic leaders about the success of the program with the hope I could expand the program for everyone, not just cancer patients, but anyone struggling with health adversity that wanted to learn how they too could attain their vitality during that time. And I remember after my morning patients going down the stairs at Mayo Clinic, and I was kind of in a hurry to get to this presentation because I was running late. I'm always late. I'm too busy living. And as I'm going down the stairs, I remember my legs were just profoundly weak. And they were like shaking. And I just, we all do this. It's like, did I eat breakfast? Did I drink too much coffee? And I was like, you don't have time. Get there. You need to present. I get to the door and I try to open the door. I remember, oh my gosh, I can barely open it. And at this point, I'm like almost diaphoretic or sweaty feeling and really not well. And I open the door and there's a woman on the opposite end. She kind of pushes it open and she kind of gives me this discerning eye, like, where have you been?
Yeah.
And she like sternly points to my table. I'm like, oh, you're having a bad day. Usually I would go in and say a light comment to everyone in the room. Everyone's in their suits, very formal. Mayo Clinic's a very formal, amazing place, but still quite formal. And usually I would kind of make a light comment to just bring some love into the room, spice things up a little bit. But I thought, So I sit down at my chair. Everyone's around the table, large table, people on the outskirts of the table, and eyes on me. And I grab the mouse, and there's this big screen at the opposite end. And have you ever tried to control the efforts of a mouse with the cursor, wherever it is on the screen?
Oh, yeah.
And you feel like the mouse is not having a connection or the battery's dead. You look, you kind of shake. Well, that's what was happening. And it was like I was not coordinated. I was starting to lose coordination. And then the cursor started getting lighter and lighter and lighter. It was this really unique visual that I remember. My last conscious memory was a woman next to me had red nail polish on that was chipping.
Wow.
I mean, it's just so weird how the mind, and I remember kind of looking down and that was my last conscious memory. And I had a 4-minute near-death experience. And that's when I met God. It's crazy. It's I'm filled with chills when I share that. And so what I would describe, and I have had meetings with Dr. Grayson, and I was like, I don't know, is this really? And he's like, this is definitely a near-death experience. And I certainly think it is, but I never wanted to be one to say, oh yes, I had a near-death experience, but he did include it in his 10,000 people that have had these experiences
Wow.
since he's studied this. And what I would describe is I felt as if the hands of God were holding me. I was like floating. That's what I remember, just like suspended in this like total state of blissful existence.
Mm-hmm.
It was the experience of total acceptance of the otherwise complete unknowing.
Mm-hmm.
And there is really no other time in life that I would say I've been able to establish that. Few of us could. Like, how do you ever totally accept or hand something over? Unless it's in the presence of something divine and sacred. And that's what this was. And it was just like embodied love. And I just felt this nourishing grasp and holding of my body from a very divine presence. And that to me was God holding me. And early in this experience, there was almost a sensory appreciation. And I remember this single little piece of hair in my lipstick. You know, so there was like kind of this like subtle awareness as I went into it. And then it just evolved in this just state of total blissful being, ultimate stillness. And to this day, if I want to meditate, even if I'm on a run, I will just sometimes shut my eyes and just go back to that moment of true stillness. It's beautiful. And so those 4 minutes, and then I came back to, I was in no hurry to come back to, I could have stayed there forever.
Wow.
It's such just hearsay, you know, and I'm so blessed to be able to work with people that are dying and have had other health adversities, that if I would have died, I would have been okay knowing this, knowing that when we die, if I go back to where I was at, it's okay. You're taken care of. It was beautiful. And so what a gift that I have that knowing, like the true knowing of what life beyond this level of conscious experience is all about. And it's one where we're not judged, and it's one where we're truly whole in the embodiment of love. So it's remarkable.
Wow.
Really remarkable. So I never got better. Yeah, do you have a question?
No, I'm just listening to your story, and so many things are coming through my mind. But I'll share something with you. Like recently, I've been meeting more people who have had, whether it's a near-death experience or they went through something that potentially could have been fatal. And it's not like I'm looking for these people. I'm just literally just thinking about my origin story of like how you said like there's got to be adversity for someone to like go and want to do something like this podcast and, you know, share these stories of just resilience and just being able to keep going in life. And this woman that I met recently shared a story with me that connected in a different way. It was literally today, like right before this podcast. And then she just came up to me and she was just telling me like, you know, I feel like I'm supposed to meet you here. And I went into a flashback where I remember being in the ER room or the ER with like cables all hooked up onto me and like the oxygen mask and all this stuff and just like trying to figure out how I ended up there. I was in a car accident in 2016 that landed me in the ER. And when I was there, the doctor that was taking care of me, he's like, I'm going to come check up on you in a little bit. And he came back. And when he came back, he was looking at the chart and what the paramedics had put on some report. And he looks at me, he's like, well, you should consider taking a second chance at like your life, looking at what you're doing and actually do what you really want to do with it because you're very lucky to be here. And I didn't know what he meant. But it wasn't until after later when I went to the junkyard to go see the car and I was like, whoa, that could have been me. Like just not here anymore. And so I like thinking about it, I'm getting goosebumps right now. Thinking about it, I'm like, I've met multiple people who have shared stories of, you know, a parent passing or like, you touched on something about spirituality and connection to God. Like my grandparents all passed away when I was younger, but there's a specific grandfather, my mom's dad, that I feel like this person has, like there's some sort of connection to why I'm still here. Because there's been different situations in my life where it's been close call. And I'm like, I have no idea why I'm still here or how this even happened or why I meet wonderful people like yourself, where I'm able to listen to these stories and just be like, wow, there's something here saying like the power of the human spirit, like God exists, like life is, you're okay always. Everything's always going to work out. And part of the reason why I do this podcast is because people are like, you have such a soothing voice. Like you have a calm voice. Like you're so like chill. And I'm like, I'm not trying to do this. It's just the way that it comes out. And my therapist thinks I should be a therapist. I'm like, okay, Karen, like let's calm
pretty
down.
much do this.
Yeah. But like touching on spirituality, real quickly, like you said you grew up Catholic, you're Catholic, and you, in the beginning of this podcast, you were saying that there's something connected to that like kept you whole, like it kept you grounded, like something in a higher power, belief in a higher power keeps you grounded through things of like, trials and tribulations or health scares or just maybe even the loss of a loved one like you experienced. I had no idea that you went through that. My heart and my soul just literally want to ask, like, how do you keep it, like you yourself, how do you keep yourself together when you're here and you know everything's okay, but you see somebody else going through something, like for example, a patient of yours, right? And they're going through a cancer treatment or they're going through some difficult situation in their life. Or perhaps you said you have a daughter and you have conversations with her. What keeps you in that space where you're like, I know that I met God and I had this experience that life is okay. I'm going to be okay no matter what. But there's people who haven't had that, right? Or don't even know what that would be like. It's kind of hard to imagine for somebody who is just listening to this. But like, if you could kind of share what keeps you in that place of like, okay, it's going to be okay. Because it seems like you're that type of person. Like if you were my doctor, you'd be like, you're going to be fine. Like,
yes and no. I love how you're saying that. So I've learned so much from my daughter, actually. She's very wise. My husband, who passed away, was a brilliant person. And he was really filled with so much love and kindness for other people. And she reminds me of him in terms of her ability to process things. And like you have such a beautiful connection and read on people. I agree with your therapist. You should be a therapist. And you actually embody that stillness in a way that allows other people to open up and be comfortable in their own vulnerability. And that is a gift. You are so present in this conversation that not many people can do that. That is so kind of you to offer your presence for me to share my story. It's very selfless. And a lot of people aren't able to do that, So you are a very gifted young man. But what I would say is what I learned from my daughter was about validation. And one time she looked me in the eyes, and I think I'm better for my patients than I am as a mom. It's so weird how I wish I could be a better mom, but sometimes our weaknesses and our strengths don't really balance out with our kids. Right? Yeah. You're just like on autopilot. Like you're like, don't do that. I holler. People be like, she seems a little bit different with her child. It's like, she's my child. Yeah. She should know better, but how would she?
Yes.
So I really am working on being a better mom. It doesn't come with a handbook. I wish it did, but parenting is so hard. So parents, don't beat yourself up. We just do our best, right? And she's just amazing. But she told me once, she's like, Mom, you're not validating what I'm saying. And wow. That was because it almost was like an element of pride, what she was perceiving as toxic positivity. I would kind of always be like the school of hard knocks with her, again, in part because I didn't know if I was going to die.
Right.
So I kind of, when she was growing up, I think I was always very hard on her and very firm because I needed to know she would be able to survive if I wasn't there. And I knew that she would have love from my mom, and she always had this soft, nurturing presence from my mom. So I knew she had that. And so I had to be dad and mom. I had to kind of like fill in all the gaps. And so when she looked me in the eyes and she just said, you're not validating what I'm saying. that was the biggest like light bulb. And I became a different doctor and a different human since that time. And so with what I went through, that's where I said early on that everyone's journey is different and we should never compare ourselves to another. Like, oh gosh, she was so strong to get through that. Why am I not getting through my cancer journey so easy? Well, no, I was given a lot of gifts, I feel, to get through that, right? When my husband died, I don't know what allowed me just to be kind of quiet and, remain in that place of stillness rather than turbulence. But it's just the path that I navigated.
Yeah.
And again, I think it comes down to just that belief in something bigger than myself. But when I'm working with my patients, I always validate. And I can really recognize the pain and suffering that they may go through. And that's so unique to them. And though, I am very empathetic, I'm not empathic to the point that affects me. I don't, and in fact, it's sad for me today because one of my patients died yesterday.
I'm sorry.
And so, thank you so much. But
Yeah.
I know what her husband's going through and what her kids are going through. And she was such a beautiful woman. And I rarely have patients die nowadays. This just doesn't happen. Each year it's probably between 1 to 3 women I see pass away out of hundreds of thousands of women I see. We are doing such a good job of curing cancer, but sometimes it's just not our plan.
Yeah.
It's just not, and we can fight and fight and fight, but I don't know. I just believe in grace and accept it. Show up, like take good care of yourself. Do the things you need to do to get through that healthcare challenge or that emotional challenge or whatever that little curveball is in your life that's kind of taking you off your natural trajectory of where you want to be. And I keep on saying it, just try to find the reason why it may be there, understand it, and navigate through it in the terms that it's a lesson there for you. It's not happening to you, but you're doing this for a reason so you can rise above.
Yeah.
And as you rise above, I say so often, I feel like I've ascended this escalator of existence. It's just each time I have a level of adversity, I come up and I come up. And now I'm at the highest level of existence. I'm like at this tip-top peak of bliss. And it's like I live in these awe-inspired experiences. And like you, like the getting goosebumps, there's some people that don't really experience goosebumps. I get goosebumps at everything I do.
I love
and
that.
if you looked at my phone, there's like thousands of pictures of everything. I take flower, a rock, a leaf, a sun.
Oh my God, I'll do that too. I don't understand why though, but you're describing a different type of human right now, like a different type of experience of life. Like I said, when I met you, I was like, holy smokes, this is like the next level of like, I hope to be able to, like I said, I learned from people like you where I'm like, I hope to be able to experience this. And I hope everybody else can experience this too, because there's such a level of like tranquility, joy, happiness there. I think you said being a mother is difficult, and you were talking about, raising your daughter. My mom raised 4 boys by herself. Wow. And so she would always tell us like, Oscar, I'm so sorry, but I did my best when you guys were kids. And I'm like, Mom, literally, I understand. You don't have to explain. Like, I know it was hard. Now as an adult, like I understand. I'm like, I don't have any kids yet, but I can only imagine a single mom, from El Salvador, immigrated here in the 80s, is trying to make it work, doesn't speak English. Wow. I'm like, you went through some stuff, Mom. And she's part of the reason why I think I'm so like with this attitude of like, just keep going, like you'll be fine. Where like I'm listening to you and everything you're sharing, and I hope people who are listening to this episode are taking all these gems. Like you're literally living in the present moment and experiencing beautiful moments all day long. Like you're taking photos of flowers, of rocks, of this, the little message in was it your hotel you said? And I'm like, people don't normally notice these things. Like it takes, I feel like that type of thing. I studied with Buddhist monks. I studied Taoism. I studied, just Bhagavad Gita, just different Christianity, Catholicism, just all these different. I almost became a monk at one point in my life. And I decided, I feel like people are searching for something in this life that is so easily attainable, yet we make it so hard. Like we make it so difficult. And I'll have conversations with my mom and she'll say, just enjoy this. Like it won't be here one day. And that message, like, it's so easy for me to understand it because of like what I've been through. And I'm sure it's easy for someone like you to understand. When you try to explain it to someone, I see people in pain. I see people who are worried about a relationship didn't work out, or they're troubled by their career because they were just let go of or laid off, like the pandemic just happened, or they lost their home in a fire, which is very tragic. It happened here in California. And I feel like there's this gift that we can give people, and it's our time, right? It's sit down, listen, have a conversation with someone. They're having a human experience. And they've been having a human experience for, however old they are in this life. But I feel like that energy transfers. And what I'm trying to say here is that the energy you give off is so real and authentic. It's scary to even want to receive it. But if you can receive it, you're like, oh my God, how do you live life like this? So I had my second to last question is, you see the world in I think through a lens that you've created for yourself. Was there rehearsal for this? Was there like a mindset thing that you practice on the day? Because like sometimes we'll have conversations with people that are like, oh, I meditate for 20 minutes, in the morning, and then I go walk outside by the reservoir and have my coffee, and they have like a ritual that keeps them grounded. And I'm just curious, like, what's your rehearsal or your practice that helps you stay grounded?
Every breath I meditate. Every moment I live is in meditation and gratefulness, And so, no, I actually don't formally meditate. I want to say a few things. First of all, your mother is an amazing person. What is her name?
Anna.
Anna?
Yeah, Anna Sonia.
Tell her thank you. She has a beautiful son. I mean, really, and how you describe your relationship with her, she feels that. And it's hard to be a mom. So I love that you give her back that affirmation that she did such a good job. So what a beautiful person Anna is. I love the one photo you have on your Instagram with her. I think it was your birthday, maybe, and it was with her. It is so sweet. And I just love. I think that love is so special. The other thing I want to bring up is back to the faith and being Catholic. I don't think it matters what religion you are or what belief system you share. And I did have this amazing opportunity to meet with the Dalai Lama in March of this year. It was just transformational. And, the one thing he says is, don't take on my religion. Keep the religion of your grandmother, but follow my philosophy. And so that's why I remain Catholic, is because my grandmother was. And I feel that at a cellular level for me, at a level of my DNA, I'm most authentic and aligned if I'm one with what I came from. And, even though I'm Catholic, I've worked with some mediums and I've done some of this work. And from a virtuosity standpoint, my faith is very important to me. And though I don't go to church every Sunday, but that foundational belief system of Mary and Jesus and God is just what feels right to me. Now, that doesn't mean that I don't really admire individuals with Judaism or Hinduism or Taoism, whatever it may be. I just think that it needs to be a belief system that you can recognize as one that resonates with your own spirit. That's what's most important. Because otherwise, I think when people start throwing out, I'm this, I'm that, it's that ego speaking.
Yes.
And I don't like this when people try to say, I'm a but. No, it's not about being better than it. It's just do you.
Yes.
This is what works for me and foundationally how I get through. But for me, my meditation, what I would say is when I feel like I'm at a little bit of a rough spot, and I have my rough spots where I'm like, ooh, this is, maybe there's a lot going on at work, or I have a patient who dies, or I have a patient who's not doing good. I do the rosary. For me, that's very peaceful. That's my meditation. Yes. And I listen to it on an app called the Hallow app, and I just love that. And so for me, that's what I do. I do some deep breathing exercises. I love yoga. Okay. For me, just sitting and doing deep breathing is a little challenging because I like to kind of be more engaged and going. And I like time in nature. I run, And so that is my meditative time. And I drop back into my near-death experience in the middle of my run often. So I'll be running and I'll be dropping into those, like that, the moment of stillness. But, I, in 2019, was listed for heart transplant, and I had a heart transplant in 2021. And I was actually dying. They could not find a matching heart for me. And my donor was an IV drug user with hepatitis C. Yeah.
Wow.
So it was interesting because it gives me like such profound chills. And I think this really describes who I am today, because I don't think I was ever quite like this. This is the gift of a stranger that is able to reflect what I am today. I think I used to always live in a little judgment. I'm not proud of that, but it's just who I was, my weakness. I just would be a little bit judgy. I don't know. It's just, we all probably are. We judge ourselves. Yeah. I still probably judge myself more than I should, but I really remove judgment of others entirely. And I really just, when I see a human being, I am in love with them. I am in love with life.
Yes.
And I just love people, and I see their kindness and their gifts. And I break for their own struggles. I wish people didn't have struggles. I wish I could just remove it, but yet I have that knowing to be confident that it's there for them to figure it out for themselves so they can rise and ascend to where I'm at. And it's not that I'm above them, but it's so they can also experience that bliss, because you've got to go through the hard time to appreciate how good the good times can be. Yes. Otherwise, it's like pain. If you never have pain, you don't know what good feels like. So accept the pain. Don't always like cover it up. Like actually lean into the pain. Feel how miserable it is, because when you feel good, it feels that much better. It sounds a little crazy. But I had this heart transplant, and when the doctor told me I was in the hospital on actually supportive therapies, he said, "Dawn, I have to tell you, your donor is an IV drug user." And it's just like, what? And I was, you would think I lived with heart failure for 18 years. You would think I'd be fine, great, give me this heart. But I was really scared. I was scared I was going to lose my own heart, this like joyful heart, this beautiful upbringing, the heart that watched my daughter grow up, the heart that was one that loved my husband. What was going to happen? And now it's an IV drug user, and this is where this judgment was, what did that mean? And with heart transplants, I believe you acquire, 95% of heart transplant patients acquire personality traits of the donor. With a few hours of of learning that my donor was an IV drug user, I had this complete sense of knowing that this really was the right heart for me. And so I went to heart transplant. I remember having eye contact with my surgeon, who is one of my best friends to this day, Dr. Bashar Sariapoglu, dear, dear friend of mine. And, during any surgery I'd had up until this point, I would always make the sign of the cross and like pray.
There it is.
Now, I did go to my surgery with a rosary that my mom had made for me, and they actually had the rosary on one of the hanging like poles in the operating room right over my bed the entire time of my surgery, which is really beautiful. Mayo Clinic did that. And I just remember he had eye contact, and I had total knowing that within days I would wake up to the beat of a new heart. I was not fearful. I just remember praying for my donor and donor family with just such gratitude that I was being given the second chance at life. There were complications after my transplant. I was actually dying. I was hemorrhaging, so they had to take me back to the operating room, reopen me up. And then a few days later, I woke up, and I've had 3 amazing experiences in my life. 1, childbirth. That's the most beautiful thing. Like, talk about awe-inspiring experience. Number 3 was the near-death experience, but number 2 was waking up after my heart transplant. And I remember hearing this harmonious sound. It was like angel. I didn't know what it was, and I was just thinking, whoa, like, what is this? Like, I wasn't really sure if I was awake. I really didn't know what to think, but the sound was so amazing. And then it dawned on me, wait a minute. It was my hair brushing against the crisp white linen sheets to this powerful beat of my new heart. Like, my whole body was like going up, and I hadn't felt my heart beat for 18 years. I didn't know you could feel your heartbeat. I forgot what that felt like.
Wow.
But I was alive. Like, I was alive. I made it. And I had total clarity of thought. And what I would describe is it was like every single cell in my body was oscillating this higher vibrational frequency. And I haven't lost that. And I'm alive. I'm so alive. And I'm confident that everyone can get there.
Yes.
We just have to get out of the way and just trust to make it. So,
get out of the way and trust. Oh my gosh.
Yeah, it's so cool.
Wild.
Yeah.
Yes, I'm on board. Yes, 100%. I am a super fan of yours. Literally.
It's not about me. Well, this is actually cool, so I have to share this. So because I'm a lifestyle medicine and integrative oncologist, and I live this really healthy lifestyle, I thought, okay, so how can I like really hack the system and like do something no one else has done. This should be impossible. So I ran a marathon my 1 year heart transplant anniversary. I've run 8 marathons since my transplant 4 years ago. So I'm the only person in the world to ever run a marathon within 1 year of heart transplant. So it was really cool. Yeah, we didn't talk about that yesterday, but so that was super cool. But it was just to show, like, listen,
I am shocked.
You can do anything. So yes, I'm a runner. I love to run, and I couldn't do that. Like my life was on hold for so many years. So now to be able to mountain climb and run, and it's like all from the gift of a stranger. And so that's why I'm just so passionate about giving back to others.
Man.
And, I think the reason I just have such gratitude and love for others in life is I don't know what she went through, but she probably didn't have as easy of a life as I did. And I think her heart being inside my blissful existence is just in this heightened level of just harmony, that we live in this different realm of what most people will ever experience. And so it's so cool. I wish someone could just step in my body for a minute. I'm like, can I just like sprinkle it on? I wish people could just join this journey of life with me because it's magnificent.
Yeah.
Yeah.
You're experiencing this in your life right now, and you've been experiencing it since you said you felt the beat of your heart, like your new heart, and you forgot that your heart had a beat. Like, and then you said something where I was trying really hard not to like get emotional, but you said the gift of a stranger, like was just everything in that moment. So you're experiencing life this way. How can someone who's just like on a regular, living their life, doing everything that they can possibly do to get through what they're going through, how can they experience or try to experience this bliss that you said that everyone can attain? Like, what do you think?
I think it's hard. I think I look for the extraordinary in just the simplest little things. I
love that you said
but
that.
It's true. Like, stepping in the shower before I got here to go to the shower.
Yes.
Just like the warm, or for me, I love coffee. And by the way, coffee is actually really healthy for you. It's always linked to living longer on Earth. So enjoy your coffee.
Too.
Love it. I could drink it all day long. It's like my favorite thing.
Yeah.
And it's just coffee. So I had a cup of coffee before I came to, and it had this little oat milk. I'm vegan, and being vegan really works good for me. I feel great being vegan.
Yes.
Even just energetically, I just love it because it's the kind way for me to live it. But it's okay. I think that people can be healthy and have a little bit of animal protein and stuff. But I love being vegan, so I put some plant milk in there. It was a little foamy, and so had this. But it's warm. The feeling of the cup, and I don't know, like how clothes feel on you, how things smell. I really lean into the sensory experience of life.
Ooh.
And that's what I would say is just look for the little things that may appear a little good. And if you can just work on gratitude, it will take you from that place of deficit and move you closer to starting to see more levels of abundance.
Yes.
And that's where I would start. So I would say that trying to reframe our adversity and look for the lessons, looking for something greater and beyond ourselves. And that removes the ego from the equation more often. And then gratitude. Gratefulness.
Yes. Daily, momentarily, every second that you possibly can remember. Yeah. To just be like, nobody has to do anything for you. And everything is literally being given to you at all times, even when we're like, oh.
But it's okay. And, we need to lean on each other. And if you're in your moment of hard times, there's others of us that have made it through. So you may not be able to give gratitude when it really does feel, it's sometimes hard to, when you're swimming upstream and the current's coming at you, sometimes you have to course shift, and course shift and just look for some support during that time so you can get back on track. And that's why this love for each other, to be able to lift other people is just so important. So just lean in on other people. There's a lot of love out there. And I think that people like you and me that are able to love so easy, we just have to be open with that and engage in these human opportunities so that others can see that connection.
Yes. Yeah. Last question.
Yeah.
Paradigm shift. This is something that I've been working on recently. And it was also something that somebody brought up and was like, oh, that would be interesting. Like, what lesson or what advice would you give, like, a younger version of you or somebody who you love truly, like your daughter, or it could be anybody. Like if you could picture yourself giving advice on something that once was true for you, but is no longer, you've changed that story now. It could be about life experiences. It could be about just how to treat people. It could be anything. So what advice would you give someone that you love?
I think, we work hard at self-growth. And I think that's very, very important. And I think it's only important to a degree, though. I think we have to ask questions about self-growth, the why behind it. Because I think self-growth can create a lot of self-judgment. And I think if our reason for growing is to try to become this version of ourselves so we could show up for others and help the world maybe be a better place, or maybe help our own family be a better place, be there for our kids. This doesn't mean that you need to serve someone, 5 continents away. It just means, hey, maybe we just make dinner every night for our family, or, maybe we try to get off of work a little bit early so we can spend some time with our kids after school. So it doesn't have to be these heroic things, but really try to establish what the meaning is in our life. And that purpose of that meaning is to share it with others. And it doesn't need to be far removed from the immediate family unit or even yourself, but just be more gentle to self and establish meaning and purpose through that lens of love for others within family first, community, state, country, and beyond.
Yes.
And I think I see so many people so often that they jump way far away, right? And you can start right in your own home. And I was guilty of that. I was always trying to strive to do all these big things where, to do all over again, I would have tried to be more present within my own family, within my own home, and, be there more for, things that maybe my grandparents had going on, or my aunts and uncles, or my cousins. And instead I'm busy, jet setting off doing all these other things. But that would be what I would tell my younger self, is be a little bit more present for those that are in your most immediate family circle first, and then step out of that circle and serve the needs of others. Fortunately enough, my family always looked at that she's doing what we give her the support to do to help others. They were selfless that way, but I wish I could have maybe spent a little bit more time with them.
Wow. Jeez. I think about what you just said. It sounds like starting with your light, because you're like a light. And this is where we started this conversation, is that we're all light. And you start your light with your most loved, family present, being there, and then expand it beyond. There's a meditation that I was taught that kind of goes from that epicenter, where it's like, okay, ask this light to expand beyond me, ask this light to expand beyond this city, ask this light to expand beyond this state, ask this light to expand beyond this country. And you just keep expanding it. And that light, it's centered in love. And I feel like you have literally everything we've talked about today has just been centered around love. Like you have a very kind way of communicating, but also you're just like this light that just wants to be there for people, wants to help people. And then at the same time, you're like, I can take care of myself. Now let me help others. And that's so special. That's a gift. That's a gift, especially when you feel like you've done so much and been through so much, and you're still able to give. So I just want to say thank you for giving an hour of your time to be on this podcast. And thank you for saying yes to this, because I am just blown away by the fact that there is a human being that lives on this planet with us and just lives like you. It's so real. It's surreal, and it's so real.
Well, thank you, Oscar. But I feel like I get so much out of this exchange for my own ability to kind of ascend that escalator of just a beautiful existence further. I learned so much from your wisdom and from your light. And I'm very serious when I say that. And thank you for sharing with me how you described almost that mantra or that experience and that meditation, because I think that is really an important, beautiful way of envisioning this. And sometimes people who struggle, I think, with meditation, with deep breathing and whatnot, if they can have a narrative and a visual, that's easier for them. And how you describe that is beautiful.
Yeah, let your light expand. We're all light. We're all, constellations of stars, and we're magic. It's a miracle that we're here, literally. Like, what are the chances of, You being born, me being born. I always think about these things when I meet people. And so thank you for sharing your light with us today. Thank you for being the loving, kind person that you are. And
thank you to your listeners for listening.
Yes.
I mean, it's so kind for people to tune in and listen to my journey. So I sometimes feel guilty when I start talking a little longer. So I need to learn to be more concise, but I just get too excited.
No, that's good. Thank you guys for tuning into this episode with Dawn. Amazing, amazing, amazing episode. Stay tuned for more episodes coming up. Like, subscribe, do all that stuff. Share it with someone who needs to hear this story, and stay blessed and rooted in love.